everything. I like to have the actual papers. So that is how I did mine. So to start, for the autism spectrum disorder, I had some difficulty trying to find just a scale. Most of it was in-depth, visits and with a specialist. But I did find what is called a communication and symbolic behavioral skills developmental profile. This actually has a list of 24 questions that are scaled, that are added up together, and it's used for from 6 and 24 months of age, to give a better, indication of if your child may have the autism features. And let's see. Again, it doesn't go into much detail, but it kind of gives a basis for it, because most of the time, if it's going to be an autism screening, it's more than just the one questionnaire. So then we moved on to PTSD, which I used what they call the PC-PTSD-5 scale. And this goes over questions in the past month. Have you, and it has 1, 2, 3, 4, 5 separate questions. If they answer yes to any of them, then that's a positive score for potentially having PTSD. And then to go along with PTSD and then many of the other depression, anxiety, I did save all the, I don't know if we can see them here, all the CBT tools for the unhelpful thinking styles, all the emotions, fight or flight response, the cognitive triangle with the core beliefs, and then also the sheets that I thought were super informative, that can be used, that the patients can use. Actually, I can't see them, sorry. The ABC form. I also have the whole checklist of cognitive distortion, that outline that was very informative. Let's see. The decatastrophizing worksheet, challenging negative thoughts, and behavioral, which one's this called? Behavioral experience pleasant activity scheduling sheet. And again, just more sheet tools, handouts that can be given out, thought records, mood monitoring sheets. Again, I know that they can be used for several different diagnoses: anxiety, depression, PTSD, other things. But I thought they were great and I wanted to keep them to use as a reference. Next, we moved on to anxiety. So for generalized anxiety disorder, I have the GAD-7 scale, which has 7 items that you would ask the patient in regards to symptoms over the past 2 weeks. And then scoring, let's see. 21 could be the highest. So anything over 15 would correlate with severe anxiety, and then 10 to 14 moderate, 5 to 9 mild, 0 to 4 minimal anxiety. And then I also had an anxiety scale for social anxiety or social phobias for adults. Let's see. And this has 10 questions on it, with a response of never, occasionally, sometimes, most of the time, all of the time. And this is in regards to symptoms over the past 7 days that the patient would give answers to. And then again, it's tallying up the score, and then getting the average total score, and each total score amount correlates to the severity of it. Let's see. And then we moved on to major depression disorder. So I had a couple of different ones. I have the Edinburgh postnatal depression scale. Again, I know that's for postnatal people. But I thought that was very interesting. That's a 10 questionnaire, 10 item questionnaire where you add up the scores and gives us the information in regards to the score on if it's severe, minimal, all that in regards to prenatal, postnatal depression scale. Then I have the PHQ-9 depression scale, which is made up of the 9 questions, adding up the scores. Then you're going to take the scores and correlate it to the key, which is score of 20 to 27 is severe, 15 through 19 moderate, least severe, 10 to 14 moderate, 5 to 9 mild, 0 to 4 none. And again, that can be used for anybody. And another scale I had for depression was the patient health questionnaire 2. So this is just the 2 questions asking about the symptoms over the last 2 weeks. And if there is a score of 3 or greater, because you can score 1, 2, 0, 1, 2, 3 for each of the 2 questions with a maximum of 6, but 3 or greater would imply major depressive order. I also have in here postpartum support and perinatal mood and anxiety disorder fact sheets, just to help give them a little bit more insight into postpartum. I have the cycle of depression worksheet that was handed out, which I thought was extremely informative. Let's see, and then we move on to, substance abuse. And I have, for that, I have the, let's see, which one do I have? I have the audit 10 for the alcohol use disorder, which we use quite often at work, made up of 10 questions, answers, let's see, can range up through. A score of above 8 is suggestive of an alcohol problem. A score of above 4 for men and 3 for women is an alcohol problem. Let's see. And I also have within that section the SAMHSA advisory using motivational interviewing in substance use disorder treatment, which I thought was very interesting and helpful. So that was substance abuse. The next section I have is pediatric. I know we have pediatric depression and anxiety. I actually find this section very interesting, and I hope to work within that age group. So I saved all the, I have all the the ACE paperwork that was handed out, adverse childhood experiences and consequences, screening for adverse childhood experiences and traumas. What else? Trauma informed care site approaches to screening for ACEs and trauma, original ACE studies, all that stuff. I actually had a lot in here. In addition to the ACEs, I also had, sorry, I'm a little too far. I saved the child development theorists and theories as well to keep in this section, just for, again, another reference, which I thought was very interesting. In addition, I have the essential principles of positive discipline on the Adlerian approach, which can apply to children too. Again, found it very interesting and thought it would be very relevant for practice. Printed out the theory and practice of contemporary psychotherapies, the transcript, which was on week 3 of how childhood trauma affects health across a lifetime. And for scales, I have the pediatric, what are they calling this? Patient health questionnaire 9. Let's see, and this is 9 questions. And it is asking about symptoms over the past 2 weeks. And let's see, scoring. Let's see, each question can be 0, 1, 2, or 3 for severity of positive symptoms. And again, 20 to 27 severe depression, 15 to 19 moderately severe, 10 to 14 moderate depression, 5 to 9 mild depression, 0 to 4 none. So that was a PHQ-9, and there's one that's modified for teens. And then for pediatric anxiety, I had what they call the PARS scale, pediatric anxiety rating, which is used to rate severity of anxiety in children and adolescents ages 6 to 17, with 2 sections in it. It has the symptoms and it has the severity. sections. Let's see, so so you're going to do the symptom section, severity section, and then for scoring, the total score ranges from 0 to 35, and then it gives again the list of what the diagnosis would be if it was severe, moderate. It's a very lengthy actually it's a very lengthy questionnaire. But yeah, so that's the pediatric section. And we moved on to suicide, which I had the Columbia Suicide Rating Scale, which is asking suicidal questions, asking if you've had any ideation, non-specific active thoughts. Specific active thoughts means to act on those thoughts. And let's see, again, it gives you a rating for each one, and how you would rate them, in their severity would depend on how you would, if it's inpatient, how you would take care of them, what level of observations they would be on, which I think most of us are familiar with that. Let's see, this is just the other half of the Columbia Suicide Scale. So then we move on to self-injurious behavior. Which one is this called? Cornell Research Program on Self-Injurious Behaviors in Adolescents and Young Adults. So this has, let's see, sections A, B, C, and so A through F, which are scored. You can, one for strongly disagree when you're asking, I hurt myself to feel something. So again, it's questions along those lines. Strongly disagree, somewhat agree, strongly agree. Then these are added up, obviously, and the score is, again, just like most of the other ones, based on severity. The higher the score, the higher the severity. And again, I think most of these apply to, would be different in each situation, whether it's inpatient or outpatient. And then intimate partner domestic violence scale, I had the HARC questionnaire, which asks H is, so for HARC, H is humiliation, A is afraid, R is rape, K is kick. So you're asking if they've had any of those symptoms. Have you been humiliated by a partner, afraid, have been raped or sexually abused? Have you been kicked, hit, slapped? And then there is a yes or no, and 1 point is given for every yes answer. A score of 1 or higher indicates intimate partner violence. And that are questions for over the past year. And then we come to, so this scale for dementia, I had a difficult time finding a basic scale for that one as well, but this actually was titled International HIV Dementia Scale, but it's not inclusive to HIV patients. This is a scale that uses memory registration, motor speed, psychomotor speed, what else? Memory recall. And so let's see, how are they scoring this? Oh, okay. So you're gonna get, it's actually different for each heading, it looks like. And then for the final scores is the sum of the scores on all the items, with a maximum score of 12, and a patient with a score of above 10 should be evaluated for possible dementia. And so that is my binder. And again, I'm one of those people who saves every paper because I'm a very hands-on person. And I may add to that because I do have a whole box of papers from this semester and from other classes that I think would be relevant and helpful to practice. So that is it. And thank you for an enjoyable semester, and happy holidays.